Did you know people with PTSD are up to 4 times more likely to suffer from chronic headaches? For many, it's not just emotional pain. Trauma literally rewired the brain and the body to create real physical suffering. And the painkillers alone, they rarely solve the problem. Today, I will show you why PTSD and headaches are so deeply connected, and how an integrative approach that blends advanced neuroscience with Chinese medicine can bring true relief. Welcome to ACES Health Talk. I'm Dr. J.D. Yang. Let's start with the science of trauma and headache. When the brain experiences trauma, the stress circuits between amygdala, hippocampus, and prefrontal cortex become dysregulated. The amygdala is your fear center. Stay on high alert. The prefrontal lobe cortex, which usually calms it down, but loses control at this point. This leads to a constant flood of stress hormone like cortisol and norepinephrine. Over the time, these chemicals inflame blood vessels and the nerves in the head, triggering headaches. QEEG, or quantitative EEG, brain mapping shows us exactly how this looks. Excessive high beta brain waves, the signature of hyperarousal, and reduced calming alpha waves. And the science doesn't stop there. Trauma even leaves epigenetic marks, changes in gene expression. That locks the nervous system into a chronic fight or flight state. This not only fuels PTSD symptoms, but also makes the brain more vulnerable to headaches. In Chinese medicine, trauma is said to disturb the shen, the spirit of the heart. Unresolved trauma leads to liver qi stagnation, a buildup of tension and stress energy. This causes qi and blood to rise towards the head, manifesting as headaches, irritability, and insomnia. Over the time, it can also develop into the problem with other functions of the liver energy system, like arthritis, fibroids, GERD, and breast cancer in women. Over the time, the kidney essence is drained by chronic fear and stress, weakening resilience and leaving the mind restless. So, while Western medicine describes hyperactive circuits and inflammation, the Chinese medicine describes disrupted energy and spirit. Both point to the same truth. Trauma destabilizes the whole system. At ACES Clinic, which has a locations in Greater Philadelphia area, New York City, Middletown, New York, we combine modern science with the wisdom of Chinese medicine. Here's how an integrated pathway looks. QEEG brain mapping. We start with a brain map that shows where circuits are overactive or underactive, and we provide neurofeedback. Patients learn to retrain their own brain waves, shifting from hyperarousal to calm regulation. TMS, transcranial magnetic stimulation, this non-invasive therapy stimulates the prefrontal cortex, restoring control of the fear circuits of the brain. Advanced nutrient therapy, magnesium, B vitamins, omega-3 reduce neuroinflammation. NAC and methylation support help repair neurotransmitter balance. We also test to identify if you suffer from pyrrole disorder, in which you lose B6 and zinc in the urine, which cause tremendous amount of a low tolerance to stress, immune deficiencies, and so on and so forth. If you're interested in getting evaluated, please contact us for the consultation. Acupuncture. A lot of acupuncture points like gallbladder 20, large intestine 4, and the liver 3 can relieve the headaches and calm nervous system, while in-turn the point between your eyebrows can help reduce anxiety and insomnia. Acupuncture is a fantastic treatment to relieve the energetic blockage which happens every time we are under emotional trauma or distress. Chinese herbal medicine. The Chinese patent formula can help smooth liver qi, calm the shen, and restore balance and reduce the headache without any side effects. This is not about replacing one system with the another. It is about uniting them for maximum healing. Let me share a real case. A 42-year-old woman, survivor of childhood trauma, came to us with chronic migraines, nearly 15 a month, alongside nightmares and severe anxiety. Her QEEG showed excessive high beta activity in the front cortex. Lab testing reviewed low magnesium and omega-3 levels and insufficient methylation. From a Chinese medicine perspective, her pattern was liver qi stagnation with deficiency. We created an integrative plan, neurofeedback sessions to retain her brainwaves, TMS to stabilize mood and reduce the headache, magnesium and omega-3 supplementation and methylation rebalance to repair biochemistry, and twice-a-week acupuncture to relieve headache and calm the spirit. Within 3 months, her migraine dropped to 3 or 4 times per month versus 15 times per month. Nightmares decreased, sleep improved, and she began to feel grounded for the first time in years. Her follow-up QEEG showed normalized brainwave pattern for 55%. So, if you suffer from migraines or headaches with a history of trauma, don't lose hope. Here's the evidence from the research. Research supports this integrative approach. Studies show PTSD patients are up to 4 times more likely to develop migraines and tension headaches. Neurofeedback reduces PTSD symptoms and headache frequencies. TMS is FDA approved for depression and is showing great promise for PTSD, particularly when we are guided under the quantitative EEG. We can personalize and navigate to the area we can modulate the abnormalities of brainwaves. So therefore, we could use this technology to treat anything, everything that is caused by brain electrophysiological abnormalities. Acupuncture, of course, has been proven to reduce headache intensity and improve trauma response symptoms. And the nutrition, especially the nutrition cocktails designed based on special panel of the blood work we use at ACES clinic, that can help us identify epigenetic reasons that cause you biochemical imbalances contributing to your physical and mental health issues. Together, these therapies offer something no single pill can, a pathway to rewiring both brain and body, both chemically and electrophysiologically. So, if you or someone you love is struggling with PTSD and headaches, please know that healing is possible. At ACES Clinic, we combine advanced neuroscience like QEEG, neurofeedback, and TMS with acupuncture, herbal medicine, and nutrient therapies to bring true relief. Click the link below to schedule a consultation. You don't have to live with pain and trauma forever. There is hope, and we're here to help. Thank you for watching the episode. Stay well and happy. We'll see you next time.